Hi, today we'd like to come back on the topic of Hyperemesis Gravidarum and discuss one of its most prominent symptoms, which is excessive salivation. Now, a lot of patients have come to us and have scheduled consultation with us discussing why are they experiencing excessive, uncontrollable salivation during their pregnancy. Now, this is especially worrying for those first-time pregnancy mothers because they cannot seem to stop the salivation no matter what kind of medication they take. The salivation is constantly occurring to the point where it's affecting their daily life, regardless if it's their life at home or with relationship with their friends and colleagues and family. Even at work, this salivation is constantly occurring. Even during sleep, that's how excessive this salivation is happening. But they don't know that it's actually caused by Hyperemesis Gravidarum. So these patients, they only have a dominant symptom of excessive salivation. They are considered lucky because they don't really have severe vomiting, they don't carry the severe nausea. Although there is these symptoms there, it's just slightly milder. They don't really suffer from insomnia, and then the weight loss, the dehydration, malnutrition, all are there but at a lower scale. However, they have a dominant symptom of this excessive salivation. So first thing we tell our patient is that first of all, you are considered very lucky to have only excessive salivation as a prominent symptom. So you have to thank your lucky stars firstly, because those who have really severe hyperemesis, you can only imagine the pain and suffering they're going through because of the severe nausea, being unable to sleep for days upon days, and then the mental instability, unable to eat anything, drink anything. They only can rely on IV fluids. It's very detrimental to their health, and a lot of them need to abort the baby because it's getting too severe until it threatens their own life. So these patients who have only excessive salivation, most of them can go on to full term without really having any external management. So first thing we tell these patients is that first of all, they're lucky. Second is that we need to keep up hydration for these mothers because they are losing a lot of fluids, especially salivation. They cannot control it. Usually they will experience some form of dehydration. Now this can affect the fetal development as well as the mother's systemic some problems as well. So we want to keep hydration as a priority. Try to drink a lot of water, keep your hydration at an optimal level, and then if you really cannot bear it, then you can go to your nearest hospital to receive some anti-salivation medication. However, the best treatment for this form of Hyperemesis Gravidarum with excessive salivation as a dominant symptom is of course our HCG desensitizer, because all these M1 receptors in your salivary gland, they are being hypersensitized by HCG during your pregnancy. So our treatment works by blocking this HCG from binding on the receptors. So when patients come to us with these symptoms, only a few administrations of injections of our HCG desensitizer, so it's injected via intravenously, and over a day you can quickly see their symptoms subside. So this is of course the best recommended treatment. We recommend you that you come to us immediately if possible. We are unable to deliver this medication internationally, unfortunately, so the best method is still to come to us directly. But for those who are unable to come to us, keep your hydration high, and go to your nearest doctor and seek some anti-salivation medication. It might help manage it. It might not be very effective, but at least something that helps slow down the salivation. And very quickly, you will have a full-term pregnancy if you hang on. So get in touch with us via the website, set up a consultation, let us know how we can help you here at the hospital on your pregnancy journey.